if you guys have noticed that over the past years, the focus has changed on the basic sciences, that is the first year and second year subjects. Plus, a lot of us tend to think AIMS is very difficult. It is not so. It's just a bit tricky. You need to apply what you have learned. So I would say to crack AIMS, you need to be strong with your basics. Yes, you do need to learn some factual stuff, but that is comparatively, in lesser volume in the exam. It's more about how much you've understood what you've read and you apply that in the exam, and I'm sure you'll get good results.
If your concepts are very strong and if you have done your internship, you have a little bit of clinical knowledge, then I'm sure it will be very easy to crack AIMS, because these days they are asking only the clinical question and the basic stuff. They're not asking any hi-fi stuff. The new exam pattern of AIMS only checks your basics and your clinical knowledge. You need to have good concepts and solve previous year MCQs. It will help you a lot to crack AIMS.
So for AIMS, I would like to say one thing, that for AIMS papers, the questions, they look really convoluted and they look complicated, but it's actually not. So most of the questions will be from your basics only. So for AIMS, your basic sciences should be very strong, first year and second year subjects. And this year in the AIMS paper, a lot of OG questions had come. So your OG, Obs and Gynae should be part of the preparation, should be really strong. And even if you don't get time for doing the final year subjects, because I didn't have time to do medicine, surgery or pediatrics, I hadn't touched any of them, only the very high yielding portions I had read. So even if you don't have time to read all that, you can, if your knowledge of the basic sciences is strong, then you will be able to answer most of the questions. You can, for AIMS, you have to also pay special attention to emergency medicine. And the one integral part of the AIMS paper is image-based questions. So for image-based questions, most of the times, many of the books will have images for the major things, but sometimes images will not be there for each and every concept or each and every point that you read. So for that, what I used to do was, when I'm reading, if I feel that a particular point or a concept might have an image, I'll just Google that particular thing and I'll see the image, I'll store it in my brain and I'll store it somewhere, maybe in my phone or laptop, and I'll see it later, so that if any image from that particular point or concept comes, then I'll be able to address it very easily. Apart from that, AIMS, as for all the papers, AIMS also gives a lot of repeat questions, so you should go through all the previous year question papers that are there. You can use any book in the market that's available. And apart from that, since we're already on the topic of image based questions, if you have the time, you can go through all the images that are there in Robbins, because many image based questions are directly copy paste from Robbins. So if you go through them, you don't have to think much, you'll already know the picture and you can easily answer the question. And in AIMS, you have to read between the lines in the question, you have to think a little, extrapolate a little. They like NEET and JIPMER and many other papers, they have direct one-liners, but AIMS also has some one-liners, but many of the questions you have to think and apply the knowledge that you have, and then only you can reach the correct answer. So if you see a question and you feel that it's very difficult, don't panic, just think a little, read between the lines, and you should be fine then.
You need to analyze last 3 years papers, and once you analyze them, just see which topics are asked more, what kind of questions are more, and the rest would depend on how you manage all the subjects. Basically, you just need to focus on your strengths and make up for your weaknesses, that's all. The rest, it all depends on luck, like 90% of your effort and 10% luck, basically.
Main thing is stick to the basics, concentrate on your basics, concentrate on the first 2 year subjects, because you have to be thorough in those, and once you're thorough in the first 2 year subjects, you can easily handle the third year and final year subjects, because AIMS is more like USMLE. They'll integrate everything. They won't give you any direct subject question. They'll be like a medicine question, it will include physiology, it will include biochemistry. So you have to do integrated study for AIMS. Time management is not at all an issue in AIMS. You'll easily finish the paper. Like, I followed online question banks, I followed a few apps which were like really helpful. So just keep doing questions, you'll know what they want, you'll know what they keep asking. Though they won't directly repeat many questions, but still the topics are heavily repeated. Be thorough with the high yield topics and don't worry about the controversial questions. Don't waste your time on that.